Our topic for today is anemia. Now, anemia is a condition which is characterized by the following. So, first one is the reduction in RBCs, that is red blood corpuscles. The second condition which is responsible for causing anemia is the reduction in hemoglobin. And the third condition which is responsible is the reduction in packed cell volume, that is PCV. Now, anemia is classified into two types. So, the two broad classifications of anemia are classifications of anemia. First one is the morphological classification. Morphology means the outer appearance. So, morphological classification is based on the size of RBC plus the color of RBC. Now, the normal color of RBC is red. So, morphological classification, it has further three types. First type is the microcytic hypochromic anemia. That is, micro means small and hypochromic, chroma means color and hypo means less. So, in this type of condition, the size of the RBCs is small, that is micro, and hypochromic means less reddish. So, in this type, the small size of RBCs and less reddishness and more brownness of RBCs causes this type of anemia, that is the microcytic hypochromic anemia. Then the second type of anemia is the normocytic normochromic anemia. Now, normocytic means the size of the RBC is normal, and normochromic means the color of RBC is also normal, so reddish in color. Now, as I told here that microcytic hypochromic, micro means small in size. So here an important point to remember is the volume of RBC is, now the normal volume of RBCs is 80 micron cube. So as the size of the RBC is small in microcytic hypochromic anemia, so the volume of RBCs is less than 80 micron cube. Now in case of normocytic normochromic anemia, the volume, as I just said, the normal volume of RBC is in the range of 80 micron cube to 100 micron cube. And the last type in this morphological classification is macrocytic hypochromic anemia. Now macro means large in size and hypochromic means less reddish in color. So the size or the volume of RBCs is more than 80 micron cube, as it says macro, and the color is less reddish. So this was regarding the morphological classification. Now the second type of classification we have is the etiological classification. Etiological classification. Now what is etiology? Etiology is the cause or the origin of a disease. So what is the cause or origin of the disease known as anemia? So etiological classification has three types. So the first one is, that is the first cause of anemia is due to increased destruction of RBCs. The second cause is decreased production of RBCs. And the last cause is blood loss. So due to these three reasons, the anemia, which is a condition caused due to the reduction in RBCs, hemoglobin and packed cell volume, is caused. Now let's see the details about the morphological classification. Now morphological classification, as we just talked about, it is classified into three types according to their size and their volume. So the first one we have is microcytic hypochromic anemia. Second we have is normocytic normochromic anemia. And the last type is macrocytic hypochromic anemia. So to begin with, first is the microcytic hypochromic anemia. As we said that the volume of RBC is less than 80 micron cubes. So what may be the cause of this type? So the first cause is iron deficiency. Now why iron deficiency is a cause of less size or the less volume and less redness of the RBCs? So iron deficiency. Now as we saw in the definition of anemia, that anemia was caused due to reduction of hemoglobin. So hemoglobin also contains iron molecules. So if iron is deficient, then it causes less hemoglobin production. So if less hemoglobin is produced, it will cause small or decrease in size of RBCs. So iron deficiency is a major cause. Then second cause of microcytic hypochromic anemia is the chronic inflammatory disease. Now chronic inflammatory disease is caused in case of patients with tuberculosis. So tuberculosis may also lead to microcytic hypochromic anemia. The third cause is protein deficiency. If proteins are deficient in our diet, it leads to microcytic hypochromic anemia. And the last cause is thalassemia. So thalassemia is of two types. Thalassemia is classified into two types. First is the alpha thalassemia and second is the beta thalassemia. So alpha thalassemia is caused in fetal life and it occurs due to less production of alpha chains. And beta thalassemia is caused due to less production of beta chains and excessive production of alpha chains. So these were the causes of microcytic hypochromic anemia. Now the second type of classification is normocytic normochromic anemia. So here, as we talked, that volume of RBC is normal, that is in the range of 80 to 100 micron cube. Now normocytic normochromic anemia is subdivided into two types. So there are two types which leads to this kind of anemia. So first is the increase in the reticulocyte count. And the second type is decrease in reticulocyte count. Now what is reticulocyte? Reticulocyte is a product which is involved in the process of formation of RBCs. So reticulocyte gets converted into RBC and it is the last step in the formation of RBCs. So reticulocyte count, if it gets increased, so the reasons for that or the causes for that are the hemolytic anemia. Now hem means RBCs and lytic means destruction. So destruction of RBCs leads to increase in reticulocyte count. So if RBCs are less in number, it will eventually lead to increase in the process of formation of reticulocyte. And the second cause is blood loss. Blood means RBCs. So if RBCs are lost, then the product which is formed before the RBCs, that is the reticulocyte, it increases in the blood. So blood loss causes increase in reticulocyte count. Now moving further to the decrease in reticulocyte count, we have the first cause is bone marrow disorders. Now what is bone marrow? Bone marrow is the main manufacturing factory of the raw material of the RBCs. So if bone marrow has disorders, then it will lead to decrease in reticulocyte count. And if reticulocyte count decreases, it leads to less RBC production. Hence anemia is caused. So this type of anemia is called as aplastic anemia, which involves bone marrow disorders. So this was regarding the normocytic normochromic anemia. Now the last type we have is the macrocytic hypochromic anemia. Now this type of anemia is majorly caused due to deficiency of vitamins. And as we saw, the volume of RBC is greater than 80 micron cube. So again, macrocytic hypochromic anemia is subdivided further into two types. First one is the megaloblastic anemia and second is the non-megaloblastic anemia. So megalo means large or increased size. So megaloblastic means increase in the size of RBCs. And non-megaloblastic means reduction or decrease in size of RBCs. So if the size of the RBCs is increased, this type of disorder is caused due to vitamin B12 deficiency. If vitamin B12 is deficient in the body, megaloblastic macrocytic hypochromic anemia is caused. And the second cause of this is the folic acid deficiency. And megaloblastic anemia can also occur if drugs are induced in our body. Drugs induction also causes megaloblastic anemia. Now the causes of non-megaloblastic anemia are alcohol consumption. The second cause of it is pregnancy. In some pregnant women, the size of the RBCs decreases. Hence, that condition is called as macrocytic non-megaloblastic hypochromic anemia. And the third cause is hypothyroidism. So this was the classification based on the morphology of RBCs. Stay tuned for the next video, which includes the etiological classification of anemia. Thank you.